Well, thank you, everybody. Thank you for that introduction, Jill. Does this work? Everybody said we're hoping to be a little bit interactive today, be a little informal, but our goal today really is we get a lot of reports from you as it relates to students that are vulnerable or at risk, students you see in your office that are presenting. I wish I could tell you it's the same thing. I mean, at most it's different. You know, there's really no run-of-the-mill cases that we see, but we're hoping today to kind of give you guys some tools, just give you some background information on what we do, so you have an idea of kind of who we are, how to get reports to us, and kind of talk through some of the things that we do to assist our students. I'm about to do this. Yep. You want me to do it? All right. So our agenda today, we're going to talk a little bit about campus and community life, who we are, talk about our behavioral intervention team, which is our CARE team, to kind of give an overview of what that means. Talk about care and advocacy. We're going to go over some trends nationally, as well as some trends here on campus with the students that we're seeing. We have a new resource portal on our website. We're going to talk about that because I think that will be very helpful to you all. And then Jill's going to take us through some case studies that you have. We're going to go through, and these case studies were drawn from true cases that we have seen. We've modified them, but cases that we have seen throughout the past few years. So campus and community life, just as an overview for you all, we restructured about a year ago when I came over from student conduct. And so this is who we are as a unit. When we restructured, we brought student rights and responsibilities and academic integrity into the fold. So this is kind of, we also have student legal services, our off-campus students. We're also broadening some of the outreach that we do this year to include transfer students, as well as non-traditional students, because those are groups of students that we have found that really don't have a whole lot of support here on campus. So we're trying to connect them. I mean, to speak Joe's language, we're trying to help with retention. Joe talks about that all the time, and we believe that if we can connect students, as you'll see through some of the information today, that can help with that. But really what we're going to talk about today is the Advocacy Center. There are 3 parts to the Advocacy Center. You guys have probably just heard of us as the CARE team. That's what it has been for the past several years. My role, the role that I fill has historically, part of it has been the student advocate. And so we have kind of drawn on that and kind of, I don't want to say rebrand it, but we talk about advocacy. And the reason we do that, instead of just saying the CARE team, we have several CARE team members that serve on our team here, and they can back me up on this, but the CARE team is meant to be for higher level at risk students. And so what we were seeing with the CARE team is we were getting 45, 50 students a week that we were going over. And I would say probably 60% of them, 70% were not CARE cases. They were cases that were lower level cases where student needed some type of support, but didn't need that multidisciplinary approach where we went and talked through cases. So we think those students need a place to land, and we think they should land with us, but they're not necessarily CARE cases. So we've kind of broadened this a little bit to kind of make sure that everybody knows there's a place for these cases to land. Oh, Jill, hold on a second, go through. Oh. Does it go through the, oh boy, so sorry. Hold on, let me do this. This is Allison Hayes' fault. Those of you know Allison, this is her. Bear with me, let me get on the front here. She likes the drama. I don't.
You're supposed to reveal.
Well, I'm not. So again, just to break this down, as you saw on the other side of the Advocacy Center. So under that student support tab, I'm not going to read all of these to you, but for your information, we do a lot of referrals. You know, we're a conduit to a lot of other units that can provide further support for students. We also do instructor letters. People get confused and think that we excuse absences. I'm sure all of you know that is not the case if you've read the handbook, that we do not excuse absences, but we get that frequently. I can't tell you the number of times that we get students will come to us and say, my instructor has said that you have to provide an excuse for me. You need to certify my information from the hospital. We do not do that. But what we do is we provide traumatic incident letters for students that have been through traumatic incidents, which a lot of those are Title IX cases. We had a student last year who witnessed the murder of her father in a driveway. I mean, stuff that are really traumatic level cases. And so we send letters to instructors to put them on notice that a student has been through an incident. And the intent of that is to help them kind of work through them, and hopefully they provide a little bit of support and, a little bit of leeway. We also have a student helpline. It's not really taken off. It's 293-5555. It's really no different than what we do. I think they're trying to make this kind of more of a thing out there, but students find us anyway. So I don't know if we necessarily need a helpline. The CARE team is really what probably we're going to talk a lot about today. The CARE team, again, are those higher level at risk cases. We have 2 case managers. Most of you probably have worked with them. If you have not, they're wonderful. Katie Spraggins and Allison Hayes, who actually helped found the CARE team back in 2016. They do a lot of the bulk of our case management. And so the cases that fall in here are cases where students really need that social work kind of approach. We also do risk assessments. We're going to talk a little bit today about how we assess cases through the CARE team, but we also do higher level risk assessments. Jill and I are trained. Hopefully Freddie will be trained because we don't have any men trained on campus. It's all women that are trained in our higher level threat assessment. But we do threat assessment based on, if it's warranted based on the assessments that we do. If it kind of points us in that direction, we are trained to do some threat assessment. And then we have a database that we use. We use Advocate. And it's the wonderful thing about having a database is that all of those academic integrity cases, the CARE cases, the Title IX cases, general student conduct cases are all housed in one area. So when we get reports for students, we can see their history. And that's crucial because it helps us understand what's going on with the student. So if you send a case to us with a student that's struggling academically and we look and we're like, oh, last year they had a Title IX case where they were a complainant, and the year before they had a case where they were hospitalized for suicidal ideation. That certainly obviously ups it in terms of the level of care that we're going to give that student and the approach we're going to take. So we have a database where we keep all of this information. It is locked down because it is pretty sensitive information, but we can see kind of everything that's happened with that student since they've been here. And then we do a whole lot of crisis support. We do everything. Something important for you all to know, if you have students that come to your office that are in crisis and they need some extra funds, we actually have a couple of foundation funds that we run. So we will help support students. I had a couple of students in my office I'm trying to think of in the past year. We had students that had a house fire, an entire apartment complex, the whole top floor burned. And so we had several students that needed housing. So we have emergency housing that we can put students in at Vandalia. I like to think of it like an Airbnb. We have it is situated, it is set. So I mean, because if you reach, when I first started, there was nothing there. They had like, you'd go check in and they didn't have any linens. So I mean, if somebody's house burned, obviously you don't just walk out with your towels and your sheets usually, you're grabbing more important stuff. So our housing is now set where we have everything from like shampoo and toothbrushes, whatever people need so that they can check in and be taken care of and have a safe place. That also goes for our students who may be in crisis, like domestic violence. We have some students, unfortunately, that are in very unsafe situations and need a place to land. And then we do emergency funds for students. Just this past couple of weeks, I've bought books for students who needed money for books. I've helped students get furniture. I've helped students get clothing. We've had some students that come here that are homeless, that don't have any family support. And so if you do find those students, you can send them to me. I was moving couches last week and beds, trying to get students set up for their apartments. So we do a whole lot of heavy lifting, literally and figuratively, in our office.
Legit,
So,
she really was.
yeah, yes, I was actually living. So, and we also do hospitalization. Unfortunately, we have students that are hospitalized here. A lot of the work that we do with the hospitalization are for mental health hospitalizations. We can also help facilitate that. So if a student is at risk of harm to themselves, those are things we can help with those petitions. And then the most important piece that I think we do with the hospitalizations, though, is communicate with instructors that student's hospitalized. And then we also can do help with retroactive withdrawals if we need to. We work with Stacy Kearns from the provost office to do an intercession form to kind of preserve a withdrawal date. So if a student, you guys know how important those dates are. So if a student is hospitalized and they're still at that 75% withdrawal rate, then they're in the hospital for 6 or 7 days and now they're down to 50%, we can work with trying to get them withdrawn at that kind of withdrawal percentage based on their hospitalization. And then we also help, the PRT event, you guys probably saw where the rock fell in the PRT last year, a couple of years ago. We're on the ground to help support that. We had a death last week of a student. And so we do, I do a lot of outreach to the parents. So when students pass away, we do everything from helping pack up students' belongings and helping get home to the families. Whenever we've had students who have passed away and they don't have clothes to bury their kids in. And so we'll go in and help pack that stuff up. So some of those heavy lifting things too, also reaching out to roommates and friends and making sure that they're supported in a time of crisis whenever they've don't know where to turn. So large range of things. So if you guys have anything, what I will say to you in general, I think the message for you is if you have a student, you don't know where to send them, you can send them to us. And we will, even if it's not something we can do, we will get them to where they need to be. All right, I'm not going to go over this with you, but I do want to focus because I think I thought there was going to be a FERPA presentation, so I was going to kind of play off of that. But so again, I don't know if you can see all of this, but the most important thing that I want you all to know is going back to 2007, whenever we had the shooting at Virginia Tech, which I'm sure you all remember, the terrible, tragic shooting. When they did some post-vention review of what was happening at Virginia Tech, one of the things that they realized was that part of the breakdown on campus was a misunderstanding of FERPA. And so people did not understand that they could share information with other departments. And so, I'm sure this is not surprising to you, but the student who ended up, the shooter had lots of issues on many parts of campus. So he was like displaying behavior that was a concern, but no one was talking to each other because they did not think they could share that information because they thought that FERPA prevented them. Under FERPA, we have lots of exceptions. And the one thing that really applies to you all is that if there's a legitimate educational interest in knowing information, you can share that with someone else. And then for ours, if there's a health and safety issue, please, those are all exemptions. So I can tell you, we work very closely with Kevin Semino from General Counsel's office. He advises us on FERPA. I'm not going to speak out of turn, but I believe I'm accurate in saying there's never been a lawsuit for FERPA that has ever been successful. So I think we err on the side of sharing information. But if you have questions, Jill and I are actually attorneys by trade. So if you have got questions, those are not our discipline. But if you have questions about sharing information, you can certainly ask us. But please err on the side of sharing because we do want to make sure that not only our students are safe, but our campus is safe. And what happened is these behavioral intervention teams that we're going to talk about really came out of this Virginia Tech. So after that Virginia Tech incident, there has been behavioral intervention teams have developed and cropped up at schools across campuses to prevent those types of tragedies. So what is a behavioral intervention team? That is our CARE team. Our CARE team stands for collaborate, assess, respond, and engage. And so that our CARE team, we'll talk about who's on our CARE team in a second. The way that works is we receive reports from you all, we receive people self-report, we get reports from parents, we get reports from all over campus. We assess those reports. Again, I think I had mentioned that not everything falls into the CARE bucket. So if it's not a CARE case, if it's something where someone maybe needs they don't know how to work with OAS to apply for accommodations. Those are things that we can help with. So some of those we may look and say, okay, this isn't really a CARE case, but we can help them. We may triage that a different way, but we assess it and then we plan the appropriate intervention. It's pretty straightforward. And the CARE team is made up of experts from across campus. And so a lot of us get assigned those cases based on discipline that we're in. So what are we and what aren't we? This is important for you to note because I think this is confusing for some people. We are multidisciplinary and collaborative. We're also administrative and consultative. We do prevention and intervention for at-risk students. I will say, unfortunately, I think 99% of what we do is intervention and not prevention. And I think part of that is because we don't have enough staff. I know you hear that from everyone else, but we are overtaxed as most people are. So oftentimes we're reacting to things rather than being proactive. Wish we could change that a little bit, but that's where we find ourselves. And then we also do a coordinated approach, again, with the multidisciplinary folks. We are not an emergency or crisis response team. I think people get confused. We are not monitored after hours. I say that as a caveat. Anybody who knows me probably knows that I monitor everything all the time. And so I am monitoring those, but that is not a given. And so if there is a situation where there's a student in crisis and it's after hours, we need to make sure that we go back to those emergency protocols where we call the police or call Caruth after hours. Because again, we are not meant to be a 24-hour service. We're also not punitive. I say that with a little asterisk. We sometimes send cases to Jill's office. And the reason we do that is because we've had students that's behavior has been so disruptive repeatedly. And if they can't comport their behavior to comply with the rules of the classroom, at some point that becomes a conduct issue, regardless of what the underlying issue is. So there are some times we will utilize conduct to be able to make sure that we can manage student behavior and also to make sure that we can get students additional help. The CARE team can mandate assessments, but we can't, if students don't follow through on assessments, that becomes a conduct matter because they're failing to follow a directive of a university official. So conduct helps with that part of it. But I will tell you, we try to be very sensitive with these because a lot of these behaviors are rooted in things that maybe are beyond people's control. So we do try to help that. But if a student, again, we've had several students who have root issues that we know are root issues that are grounded in mental health, but they behaved in a way that we just have to take some action. And we also have other units that handle various supportive students. And what comes to mind is Title IX. Title IX has their own unit that does supportive measures. So a lot of those cases go through them. What I will say though is if you don't know where to send it, I never want that to be an impediment to people. So if you don't know where to report things, you can report it to any of us and we'll get them to where they need to be. But I also wanted to say one thing, the puzzle pieces. This is what they talk about all the time. I'm gonna go back to this just for a second, is they talk about into the Virginia Tech point that I made earlier. One of the things that they say is these behavioral intervention teams are meant to be able to kind of put those puzzle pieces together because you may all see something through your office and then you talk to us and then we're looking and we see, oh, wow, this person's misbehaving. We've had an issue at the rec center or we've had an issue in a residence hall. And then we get a full picture of the person and we're able to kind of put those pieces together to, again, get the best picture so we can provide the best intervention. So that's why I like this, kind of think of it like puzzle pieces. Didn't want to skip that. So a number of referrals, and these are referrals through the advocacy center later on, but through the care team. If you look back in 2016 when we started, we only had 132. We are now up over 1,000. So anybody who's following any of the mental health trends that are happening across the campus and country are probably not surprised by that. As far as risk assessment, we'll talk about what these all mean, but most of our cases are mild. This is why we've created the advocacy center and kind of taken things out of care. Because if you look, the reason why mild's lower is because we've created advocacy, which is mild. So if you look at those two yellow lines together, the vast majority of our cases are mild. Most of our students are just having trouble adjusting to college life. They're having trouble attending class. You know, there's just that curve of being, 18, 19 years old for the most part, most of our students. Most of our students, you'll see that we meet with our freshmen. And so a lot of it are things that if we just get them connected to the right unit and kind of help support them, we do find that we can address a lot of those issues. We do have some that fall on these more critical, and those are students, again, we get students, you get who you get based on their history comes with them. There are sometimes students, a lot of mental health that we see are things they start developing when they're young adults. So things that are, that just, again, they're things that we just have to deal with. I think this is probably pretty typical, again, for this age range. Yes.
Carrie, on the last slide, what percentage would you say is reflective of actual spike in need versus increase in awareness of your office?
That's a good question. I would probably say in the very beginning, most people didn't really know about us. And so I would say that probably accounts for the beginning part of it, those initial spikes. I don't know. I mean, I think I can tell you right now, we're doing our stakeholder survey. I'm sure you all are doing those for different units. And we still see people that'll say, we don't even know what the care team is, or we don't know what the advocacy center is, or they wish we did more training. So I can't really answer that. I think it's probably a combination of both, but I do think early on it was probably because we didn't have a place to put these.
Yeah,
so
it seems like a baseline at around 425, 430, and then
spike. We also COVID. I mean, as you can imagine, COVID was impactful in many ways for students. And we also had a separate unit that handled COVID. So this doesn't count for the COVID care cases. That was a whole separate thing. Now, not to say that some of the things that the things we addressed weren't as a result of COVID, but we had a whole separate outreach for COVID. So if that makes sense.
Thank you.
You're welcome. And again, I'm not going to get too far into this, but I just wanted to show you how we assess cases. Katie and Freddie are on our care team. And so we use this every week when we meet. And so how we actually take information. This is why it's so crucial for you all to report information to us accurate and to get as much information as you can. Because sometimes we'll get something in and we'll say, the student wants to kill themselves. And then when you talk further and you get more information, you see that it's kind of a different beast than what you think it is. But we take the information that we get. And again, this is very small. I'm not asking you guys to look into the details, but just to give you an idea, we do have a standardized, tested tool that we use. And so we meet, everybody has one of these. And when we go through our cases, we take the information we have and we, the D scale over here is harm to self. This is harm to others. 99% of what we're doing is harm to self. We do have very few that are harm to others. We do have some. And so we look at the information we have and we, kind of figure out what category they fall in. And then you take the information you have here and you draw it over to wherever it is. And that's how we rank them. And like I said, those rankings are important because they help inform the follow-up that we do. And this is just, again, just the back part of it. So these are more detailed kind of interventions. So I will say just for the harm to others, if anybody who falls in elevated or above, those are cases where we do threat assessments. We have a threat assessment team that meets. I'm on the threat assessment team when it deals with students, but there's also a threat assessment team for faculty as well. And so we will meet. Those are teams that are put together immediately if there's a threat to campus. You may have remembered last year at the mountain lair when someone there's a note left in the mountain lair and they were threatening to shoot people. I think it was death by cops. There was a whole thing that was in the mountain lair. Those were the cases that go right to threat assessment teams. So we do meet regularly to assess those. But this is just the tool again. If anybody's any interest, I'm happy to share more information about this, but I just want you all to see that we do have a standardized tool. We're not just meeting and sharing information. We're actually using tools to go through and make sure we're doing the best intervention. Joe, I have to laugh. I'm going to pick on you because I figured you're going to see it. I have two different slides and they kind of say conflicting information. And I said to Allison before I started, can you help explain this? Because Joe or Freddie are going to point out these discrepancies. So I figured you would. So if you look at the concerns that we have, most of our concerns are health and well-being. But for you all, we have 18% that are academic. So we're getting a lot of academic concerns through our office. And those are things that are, students not attending class. Someone may see student in class and they have a change in attitude or they're changing appearance. We get lots of calls from parents about students not being in class and their students, not doing well. So a lot of what we do has to do is related to their academic performance. And then policy navigation, we see some students, those can be everything as easy as, again, not knowing what office to contact for something, as, difficult as somebody, again, has a death in the family and has to miss class and needs help talking to instructors. So this is kind of and 6% is hospitalization. That's growing. We've had a fair number of students so far this year that have been hospitalized for pretty severe mental health issues just in the past couple of weeks. And then here's the discrepancy that I thought you would point out, Jeff. So these are meant to be freshman, sophomore, junior, senior, grad, and profession. So I don't know how those were caught off top. But if you look at, and these are meant to be 1 through 5. So academic all the way down to hospitalizations 5. So academic is the top concern. So I thought you'd go back, Joe, and say, wait a second, I thought you said it was the second concern. See, were you gonna ask that question? Joe would have noticed that. So I asked Allison, because I was help explain this to me when I get this question. And she said, we've had 314 cases that were health and well-being and 308 that were academic. So I think it's this last part here when they were flipped. So you'll see from our freshmen through our grad students, the number one concern we see through our office reporting is academic. So again, I think probably a lot of those come from you, which thank you for that. But I do think it's important, again, to note, all these things are tied together, right? Students, who are making poor choices outside of the classroom tend to have an impact on, their classroom. I also oversee medical amnesty. And last year, I think we had a bump. And I think we had almost 60 medical amnesty cases last year. And those are cases where students are inebriated for drugs or alcohol to the point where EMS is called, that they need to have medical intervention. And that is up from, we've probably had, I think, an average of 40 a couple of years before.
We're on track to already.
And we've already had, I think I had 14 sent to me yesterday so far, just from the first 2 weeks of class. But my point being is that those choices you make outside the classroom affect oftentimes what's going on in the classroom as well. Just again, I'm sure this is not surprising to you as a breakdown. If you guys can see this in the back of the room, but this is freshmen. As you can see, I think we're on, it's usually the trend. 43% of our students this year last year, that the academic year that we saw were freshmen through our office, pretty standard all the way on down. It's pretty set. We've had a little bit of a decrease in sophomores, but again, pretty on point. But the least that we see are the graduate and professional students. And I think part of that is they have lots of support within their units to help them. But obviously people struggle at any point. Some national data that these are just a couple of things we wanted to make sure we point out. I'm sure this is not surprising to you. We are seeing students on campus with an increased historical trauma. We're also seeing students with that repeatedly say that there's a high impediment to academic performance because of stress. We see students that this is the one that I think we struggle with. 70% of students that are not registered with OAS, with their accessibility services. And so that's one of the things that we work with students is identifying those. And sometimes, students oftentimes had accommodations in high school and think they don't need them when they're here, or just don't know how to navigate that. And they have to do that themselves. The onus is on them to do that each semester. And so we work with students frequently. And I will tell you, we sit down with students and help them fill out paperwork, because sometimes that's also an impediment, is that it's not that easy for them to fill those things out. Food insecurity, 41%. That's also really hard to see. We do have a food pantry on campus. I'm sure most of you know about the RAC. We send students there. We also, we'll get to the resource portal in a second. We also share with students the food pantries in the area. Unfortunately, some of the food pantries, they're wonderful, but they're only open like the first and third Wednesday of the month from 12 to 3, and it's difficult. So we have students, I had a student over the summer that is was in foster care and is an MD PhD student, and they don't have any assistance post undergrad, none. And so she has no support whatsoever, and it has a stipend, but is unable to pay for her food. So we, over the summer, we would deliver food to her, because we could go to St. Ursula's and get food during the time that she couldn't, because she worked all day and had no car. So, there's also impediments. Someone who lives on Evansdale, we do have some smaller embedded racks on the other campuses, but they're not nearly as big as the one that we have downtown. But our rack does a great job. They have some fresh food for students, but they don't deliver, but we do. So if you have a student that needs food, we certainly can take them to them if we need to. But we really do our best to try to, we don't want students to be hungry. Can you imagine trying to get through your day if you're hungry all the time? That's what this poor student was saying. I'm having a hard time, and she's in a very intensive program, and she's not nourished. So that's a problem. And then this one, I think, also gives a little bit of hope, is that if we're able to decrease academic stress and get students involved in an extracurricular activity, they're 51% less likely to withdraw. So that's a lot of what we do with students. We have over 400 student organizations on campus. So, oftentimes it's just about students trying to find their fit. Freddie was telling me about a program through Adventure that they have. I don't know if you all know about it, but there's a program with Adventure that's a mid-semester course. I believe it's called Finding Your Fit at WVU. And so I have students that, that again, has not made any friends and is having a really difficult time. That's probably a good kind of class to connect them with. We had a student that showed up at Stewart Hall on Friday, and the police were called, and it ended up the student was just having a panic attack because they've not met any friends. And they tried to pledge a fraternity and were denied and felt so rejected by that. And so now, he's meeting with us this week, and we're trying to figure out what his interests are so we can try to connect him and help him just find, a group of people. My parents used to always say when I was little, you don't need, 100 pennies, you just need $1. You just need a friend. Sometimes we'll just need one person to connect with to kind of help them be successful. So I think that is promising. And I'm hoping that we can, continue to help kind of, again, just decrease stress and get students connected. And then how do you file a CARE report? I think most of you know how to do this, but again, and I will say, we talk a lot about care and advocacy. I don't care what you call us. I could care less. You don't need to know. It's not on you to say, oh my gosh, I think this is advocacy, or does this rise to the level of it being at risk? We don't care. Just file the report. You file the report, you get it to us internally. It's important for us because we're the ones who then will kind of route those, but it does not matter. It doesn't matter if you check the wrong box. It does not matter, it's helpful for us if we have some more information, but oftentimes if you can't, sometimes with students, they're not the most reliable reporters when they're in a very distressed situation. They're not going to accurately give you information. That's okay. If we get information that's not accurate, we still want it because we still want to make sure that we can follow up with students. So follow up the CARE team. And then and again, we're always accessible via email and our office number. My cell phone number is out there because I'm the contact for emergency, so it's there. You can find it, but I give it to people all the time. And my husband hates it. He's just like, you need to have some boundaries, but I don't. So if students need some help, it's just, I really do think that, if we can just, sometimes again, it's just caring and showing a little bit of effort to students. So if you need help and it's after hours and you need, again, most people here do have my number, but if you look at the emergency response, it's on there. You can contact us and we will certainly do our best. The other thing we're trying to do within the past year is we did get some complaints when I first started with people that were like, hey, we filed a CARE report and we have no idea what happened. That's a fair complaint. So we are now trying to make sure as part of our practice, when we get a CARE report, that you hear from the person it's been assigned to. So it's like, hi, Jill, my name's Carrie. I thank you for filing this report and for caring about our students. I'm going to be, I'm your point of contact. If you have any additional information or questions, please reach out. We can't always give information on what happens. I go back to FERPA, we can share information pretty freely, but sometimes these are, interventions that may have some aspect of confidentiality based on what we're dealing with. So we may not be able to give all the information, but we should be getting back to you all. If you file a CARE report and then you don't get something from one of us, please let me know, because that is certainly not part of our protocol. So you should be hearing from somebody when you file a report that acknowledges that and then gives you contact information for further details. Who's on the CARE team? So there's me, there's Allison and Katie, who I've mentioned, and Jill. We have someone from Caruth. Tian Hawkins is on there. She's the director of the Caruth Center. Sherry Sinclair, if you guys have not worked with her, she is just a wonder. It's funny, you think chief of police, and I think my kids met Sherry once and they couldn't believe she was the chief because she's just such a down-to-earth, lovely, like disarming human. Sherry is one of those people, I will tell you, when my phone rings from Sherry at 10 o'clock on a Friday, I'm always like, oh, because it's usually not something good. But Sherry, they're the best partners. She's available all the time. We always joke. I'm obsessed with Dateline and like murder shows. So she always runs me on the III report. So I'm always like, we're on the III. But I tease, but what I mean is that she can give us the background on students. So if a student has a criminal history or they had a problem at their school, she can pull that information. That's very, very helpful. I wish I could run the IIIs. It's like, I'm so jealous of her, but she has access to information. I tease all the time with CARE reports. I do. I'm always like, I think we need to run a III on that one because I'm totally obsessed with it. But she's wonderful and again, very, very helpful. She can contact previous schools, police departments to get some additional information. We can also do that through conduct as well, because sometimes students come and if they've switched and this is their 5th school, and we've had a couple students like that. I'm sure you all know, and there's usually a reason it's their 5th school, and oftentimes they probably have had issues at a few of them. Trish from Res Life. Going back to that slide saying 40% of our cases are Res Hall students. res life, or not res life, freshman students, most of those are res hall. We deal with a lot of students in res life. I will say a lot of those cases get routed to us at CARE and aren't handled by the res life staff, unless it's something where it's just checking on a student. And I've had some people have reached out to us, they're like, the student hasn't been in class. If they're a res hall student, you can go knock on their door, check on them, see how they're doing, and make sure that, again, they get to class, call their mother. At Katie, people will be like, so-and-so's not called me for 3 days, and they're in the room, they just don't want to talk to their mother, you know, but we can at least say they're well, they're okay, they just don't want to talk to you. The provost office, Stacy Kearns, Stacy's lovely. She's been fantastic for us to work with. I think that there's sometimes this impression that we're like siloed into like, we've got all these different areas. I think sometimes we fall back on that a little bit. We get kind of stuck in our areas, but Stacy's wonderful for us in terms of, working through some of those academic policies. And then Freddie, I always tease Freddie. My son met Freddie and said that, I always joke, Freddie loves when I tell this story. My son said that Freddie's the most aggressively helpful student or helpful person on campus. Because he is. And so I will tell you, I tease, but it's like when we're on this, when we're on our care team meetings between Freddie and Katie, you ask a question and they're like, within 3 seconds, they have the information. They know the student's history. They can tell us their GPA. They can tell us what classes they've withdrawn from, their completion rate. Like they're fantastic partners to us to be able to, and sometimes shed light on some things that we aren't experts on. So giving some information and giving some of that history. We have Title IX. They have their case managers on our team. I'm sure it's not surprising to you. A lot of Title IX cases that fall in that bucket also have levels of distress. And so we deal with, I will say we support both parties, the complainant and the respondent equally. So we don't make prejudgments. We always want to make sure that if they're part of this community that they're supported. Like I said, Katie deals with a lot of the crazy parent issues and heavy parent lifting, but there's that component, parents, I'm sure you guys are not surprised. Parents are overly involved at times, and sometimes we have to need help managing that piece. And then we have some ad hoc members. If we have a student where there's some accessibility issues that we need some additional information, we can talk to them. We have someone from health sciences. Kevin Samino, we deal with him all the time. If you all have any legal questions, again, he's amazing. He's responsive and he's very thorough, and he's just very, I think lawyers get a bad rap, but I don't think he falls in that category. He's very, very helpful. He's just very approachable. And then, obviously we're all Title IX responsible employees, and we work very, very closely with them on many of the issues. So I don't know if we can pull this up, but the resource portal, I just want to show this to you. So we just redid our website last year. As part of our reorganization, we realized we had like 6 different websites and it wasn't clear who any of us were. So we've now merged into a website. But if you go to our website, if you go to Campus and Community Life and look at the resource portal, you can click on any of these buttons, and the academic one takes you through every academic policy. It actually takes you to the absence policy, so people know that we can't write the excused absences, but because again, trying to clarify certain things. But if you have students, it's the food and nutrition. It'll take you to every food pantry within Mon County. I think there's like 7, 8, or 9 of them. And so information, their hours and how to get a hold of that. Transportation, there's information there on the bus lines and whatever we need for students if they need to get to and from the airport. Financial assistance, a lot of that links to the hub, but sometimes students don't, the whole point of this is so students don't have to go to 6 different places. They can go one place, get information, and then hopefully go from there. So I encourage you guys, sometimes you may be able to check this out and get answers to your questions without having to talk with us. But again, our goal is we did find that there was there really wasn't a hub, for lack of a better word, of information for support for students. So I encourage you to check this out. Also, all of our emergency housing information is on there, the application for emergency housing. If you have a student in need of funds, the emergency fund application is on there. You can help them fill that out, send it to us. Sometimes too, they don't know how to fill those things out. They need help in terms of what information to share. So please check this out. It's a very good resource. And then Jill's going to take you through this. But before we get through that, does anybody have any questions about Advocacy Center or CARE that I can answer? Yes.
So sometimes I'll be talking with a student, or I'll get a referral from one of my instructors, and they're not certain whether they should direct the student to make the CARE report or whether they should make the CARE report or whatever. So what's your best advice?
I can tell you it's very, as you'll see as we go through some of the scenarios, the more information we have, the more helpful I think is for us to kind of figure out, is this emergent? What do we need to do? Oftentimes, again, it goes back to students not being reliable reporters. If the student's in your office and they're sharing something, you probably can observe and maybe make, more of an objective observation of what's happening and file that report. So it all depends, but I would say probably you, because students probably, again, I'm sure it's not surprising to you, but what they're going to tell you and then what they may tell us in a report could be vastly different things. So it is helpful because if you file the report, we're going to follow up with that student directly, and that they'll have that opportunity to share information. And I also think sometimes too, we give context and say, this is what we're being told. And so it's like we can talk through those things with them and they can clarify some of that information. So I would say if you can file the report, that's probably best, because it gives us your perspective and then we can follow up with you with specific questions.
I've heard from a couple of instructors that they were concerned that when they file that care report, that the student will be upset that they filed that care report. What does the student know about who filed that, and how can I reassure?
That's a good question. I will always say, again, the lawyer in me will say nothing's ever anonymous, you know, but it isn't, because it's out there. But I will tell you, unless it's germane to why we need to share that information, we don't necessarily need to say why it was filed. Now, students can deduct it. They're in their office and they're crying and they're telling you certain things, and then we get a report. They're gonna be like, I think you filed it. But we get parents that will file sometimes and they don't want us to know it's the parent. And so again, if someone asks and pushes, we may have to share that information, but if it's not germane to why we're having the topic, that conversation, we'll do our best to make sure, because we don't want to sever those relationships. We want to, and I will tell you, even sometimes when we have that conversation, we will then talk to them about why they should be, you know, like why this person filed their report, you know, that they filed this report because they were concerned and because they care, and not because you're in trouble or not, you know, because it's scary when people get letters from people at the institution, they don't know what to do. So we will do our best and not have to share that, but we just never guarantee anonymity. But I would ask people to get over that fear, because it's probably more important for us to give them the assistance. Yeah, Rhonda.
My advice is, and I try to make it a practice, unless there's some reason you don't want to be identified as reporting it, is I share with the student when I meet with them and say, you know, I have concerns and I really would like to get you to some resources that might be able to assist you better than I can. And this is what I'm going to do. That way they're not caught off guard. The other thing, going back to who reports, I mean, it depends on the situation as well, because I've had situations where I've had a student come to me who said they witnessed another student in our class be abused by her boyfriend. And what we've done is we've teamed up, and I filed a report on what I saw in the classroom, and then she followed up and filed a report about what she saw on Beechurst Avenue with a girl being hit. And that way it provided the care team the information they needed to reach out to the student. And I also met with the student who we had a concern about and let her know that I noticed these things and this is what I was going to do. So I really think it's all about, you know, the intent is to help the student. And so I think, you know, talking to the student, letting them know the why is a key one.
And technically you could file anonymous. I mean, you can make up an email account. It doesn't have to be. I mean, you could make it up. You can make it a name. I mean, but it's helpful for us. We do like to follow up to one that let you know that, hey, we've got it. Like, we thank you for filing this, and then ask additional questions for context. But I mean, technically you could make up some, you know, those are the clown at Hotmail, and we wouldn't know who that is technically. So you do have that option. Not preferable, but you could file it.
Carrie, how are students actually notified? Are they called? Are they emailed?
Well, and it depends. I can tell you, we call, I mean, sometimes we'll use it. We text students sometimes if we have to. I don't know, Katie and Freddie, you guys can also speak to this too, Katie, but I mean, we call, we'll email. It depends. I think an email can be a little cold sometimes to people, especially if it's just off the cuff, where it's like, hey, we got this concerning report. So we do call. We also have student staff, but we don't let our student staff call in the care cases that are higher level cases, just because it's their peers and they may not know how to navigate that. And so, you know, oftentimes it's a call by our case managers, and Katie Gallagher and Skylar Brathwaite, you may see her name on some things. They actually do a lot of the advocacy outreach. And so that's fair, Katie, right? Phone calls. Yeah. We'll text students too. Like, we can text them through Navigate if we have to, but that's not really locked down. So we do try to not use that system because of some privacy issues. But we actually are trying to get the capacity to text through Advocate, but that takes some money, and you know, we're not there yet. So
what happens if we still are reaching through those channels?
we can do a welfare check if we have to. So we do. It all depends on the level. I mean, we talk through cases. Like Katie and I will talk. We've got a couple of cases we'll go through afterwards. And so we usually, the good thing about the collaborative approach is you're not usually on your own to make that call. So it's like we can sit down and say, hey, listen, I've got this. What do you think the next step is? So we do welfare checks. And just so you know, I know some people don't like this fact that the welfare checks are done by our police. Some people are taken back by that, but we do that for safety purposes. Because, you know, if we have a student that's at risk and we think they're suicidal, you know, someone could be harmed walking into that situation. So we do get some complaints sometimes from parents who are like, oh, the police showed up and they don't love that, but that is the protocol when we're dealing with a safety issue.
With those situations, because for some students, that could be,
Yes,
that can exacerbate the issue.
correct.
Do you continue to connect them with Ruth and other?
Yes, so we
resources?
try, I mean, I can tell you, we try to connect them with Caruth, and then Caruth, the issue sometimes with that level is like Caruth is, they're not governed by HIPAA, but it's this hybrid of confidentiality. So sometimes we don't know if they've connected with Caruth, so we try to get a release of information. And so Caruth then can say, hey, listen, they will always, when we send cases over there, when cases come through that they think we can help with, they will always try to get a release. So that allows them to talk with us. But yeah, Caruth is they're fantastic in terms of, they're the people we call after hours for assistance to help us talk through things. But we always try to connect them with who we think is the most appropriate, or if they have a therapist at home that they work with, we may try to connect them with that. I'll also say too, I do a lot of parent contacts. And so if we think students are at risk, we will call mom and dad and have conversations, or I shouldn't say mom and dad, their emergency contact is who I should say. We will have conversations with them about what's happening. Sometimes the conversation is, I think that, keep picking on Jill because she's sitting right here, but like, I think Jill needs to maybe not be here, right? Maybe she's not ready. This is not, she's not able to be successful. So we may have conversations about withdrawal and those type of things. So, but no, we do phone calls, welfare checks. Welfare checks we do, I mean, if we have to, but if it's a res hall student, again, if we can have least intervention where it's like, we're not necessarily, this person hasn't made a threat, that, because we do also suicide screenings. And so if it doesn't rise to that top level where we think we maybe need a direct welfare check, we will have people who knock on doors and try to see if they're okay.
So you meet for students off campus?
Yes, we work with Morgantown Police if we need to. With Fairmont, last year we had a student in Fairmont Police. Now, we prefer, and sometimes it's harder with those other jurisdictions. I mean, I've had a student that was down in Hurricane, that we did a welfare check in Hurricane, because they were posting concerning things on social media. And there were pictures of them, it looked like they were cutting their arm. So I ended up calling dad, talked to dad on the phone, got some information, but we do welfare checks if we can find out where they are. And that's where, again, I tease about those triple I's, but that's where Sherry comes into play, because she can tell us, like, we can find out some additional information that we may not have on our end. So wherever they are, we will try to find them and make sure they're okay.
Does that include out of state?
Yes. Now, I will tell you, sometimes it's a little more difficult because of their protocol, but it is, we will do whatever we can to reach them. Especially with people online now. I mean, people can be anywhere. So.
Well, we have, so many students that live like in Pennsylvania.
Yeah.
Just across the border. So.
And I will say, as a caveat with that emergency contact, if a student comes in and there's some abuse at home, for some situations, we may have to take different approaches because we don't want to exacerbate a situation if we have that information. So we do try to, again, if we have that whole picture, do the intervention that's the most appropriate. Okay, I was gonna say, Jill's gonna go through some scenarios. I think the scenarios that we're gonna go through will highlight some of this, because that'll show you some of the support and resources we utilize. But I will say, if anybody's got any questions they don't want to ask me, sometimes it's intimidating to yell in a microphone at people. So I'm gonna be here. Feel free to tap me on the shoulder if you'd like to chat. And like I said, you guys can always send us an email. We're happy to answer any questions. Thank you for your time. I'm gonna hand it over to Jill.